At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. So I'd like to start off each and every week. I'd like to say hello to all our loyal listeners. Of course, thank you for listening each and every week. And a special hello to anyone who's new to this radio show. This, again, is BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB 620 AM from 9 to 10 in the morning. Last couple of weeks, I had to run tapes. We were on vacation. And the week before, I did help my wife out. If you know of a group called MOPS, Mothers of Preschool Children. Great group. Helped them with their Pamper Day, so I was not live again last week helping them with their Pamper Day. Great group if you have grandchildren, preschool age. Great group for mothers to be in. Just to have a little break. They have child care for the kids, and they kind of talk and just get a little break from life, which is nice. So I was able to help them out last week, and now I'm back live. So if you listened to the show the last couple of weeks, we had some tape shows on great information, nutritional information. But the last live show we mentioned to you, we're going to talk about nutrition for menopause. We're going to wait till next week for that. Sorry about that. This week we're going to jump forward to a very interesting article that I saw on testosterone. So this week I'm kind of for the men. Next week will be for the women per se. But definitely the women can definitely listen this week and help out their spouse, any man in their life that may be thinking about testosterone therapy. So we're going to be talking about the risk in the second half hour of the show, the nutrition fitness segment. Of course, if you are new to BackTalk, in the first half hour we typically talk about our office, the research, answer any questions you may have about our office, the different things that we do here at the American Back Centers. Of course, we've been around for over 40 years. Dr. Dennis Miskovich started American Back Centers, again, over 40 years ago. And in the last 20 years, he saw the groundbreaking research in 1994 by two neurosurgeons, Drs. Ramos and Martin. This was later published in 94 in the Journal of Neurosurgery. For the first time and still to date, and I emphasize that over and over, and still to date, because there's so many people we're seeing out there advertising disc treatments now. And there's so many of these glorified traction tables. And the term decompression is so loosely used. There's pump-up devices that I talk about each and every week that go around your waist or neck that pump up air, and they call that decompression. If you know anything about what decompression is, to actually decompress the disc, you have to reduce the pressure within the disc in the spinal canal. With that, you form a vacuum. The vacuum truly decompresses the disc back into its original position, reducing the inflammation, pulling fluid and nutrients back into that compressed, desiccated, degenerated disc, which is the true cause of the problem, but also pulling that extruded, that herniated, bulging disc material, depending on the degree of your disc problem, back into place. So we've been doing this for over 20 years, and this is backed by that clinical research published in the Journal of Neurosurgery. And there's many, many research studies that have been done by independent sources as well as VAXI themselves, proving over and over the effectiveness, but more importantly, proving that negative pressure is actually produced and the vacuum is produced. Not just saying that we've helped a number of patients and a certain control group, because anybody can do that. You can have vitamin companies do that. You can have any type of machine company, medical machine company make claims of this, but you're actually seeing that the science is backing what we're actually saying. It's actually producing that negative pressure. It's forming that, reducing the pressure, reducing the interdiscal pressure, the pressure within the disc, and pulling the disc back in place. And again, we've been doing this for over 20 years. We've had professional athletes, famous actors have come and seen us, not for us per se, but for the VAXD procedure. We have people coming from all over the tri-state area. We've had people from all over the country. We do have a list of hotels on our website, which I'll give to you here in a few moments as well. But again, we talk about that in the first half hour of the show. The second half hour, we talk about a nutrition topic that we feel is popular or something you may need to know. Next week, again, nutrition for menopause, some natural ways to help deal with menopause so you're not resorting to the drugs and the side effects. And this week for the men, testosterone therapy, the risks, the dangers with taking this hormonal therapy, very similar to estrogen therapy for the women. We're going to give you some simple, inexpensive dietary information, lifestyle changes, and we have a great natural supplement, if you so choose as well, that helps support testosterone production. But also we're going to be talking about, more importantly, things you can do with your diet and things you can do with your diet that may be making testosterone decline even more so. The things you should be avoiding, things you should be doing to increase testosterone production naturally through your diet and lifestyle as well. So definitely stay tuned for the second half hour. We'll be touching on that again in the second half hour of BackTalk. Of course, the American Back Centers, as we talk about each and every week, we are not your typical chiropractic office. Again, since 1994, when we switched gears and became more than just a typical chiropractic office, specializing. And since then, we've been known as the area's disc specialty center for over 20 years. There's other centers that have popped up, made a lot of claims, and the biggest problem that I see, and I don't like knocking people. I'm not like that, but it's very discouraging because people will call some of these centers and they'll try to do everything they can to hide what they're doing. If people ask them, "What procedure are you doing?" Tell me exactly. Are you doing VAX-D? Are you doing this procedure? Are you doing this procedure? What is the name of your procedure? They'll make up a name for the procedure, but they won't tell you actually what the machine is. With VAX-D, you know it's a VAX-D machine. It's not a Chattanooga traction device. It's not there's DRX 9000 that went out of business because they were in lawsuits with making a lot of false claims, and then they came back under a different name, North American Medical. So you have to be careful about these things out there. VAX-D is not going away. It's been around for 20 years. It's going to be around for another 20 years because it's backed by real science and it has real results. And literally, we've helped thousands, and I'm not exaggerating, thousands of patients over the last 20 years avoid these type of very disabling disc problems, whether they're contemplating surgery, they've already had back surgery. We've helped many people with failed back surgery, even neck surgery with the cervical procedures we have here as well. But you got to be careful because there's a lot of traction devices. They're trying to hide the fact that they truly are distraction. They call themselves decompression. They call those introdiscmosis, all these crazy names, and it's not a name for an actual procedure. And again, you have to be, the actual machine itself. So you have to wonder what they're trying to hide. When you call our office, we tell you exactly what we're doing. We tell you to go on the Internet, check it out, research it. You will see that VAX-D is backed by clinical research. It's been around for a long time, and it's backed by real science and real results. So again, in 1994, roughly, of course, 20 years ago, Dr. Miskovich saw this, purchased 2 VAX-D tables, and since then has specialized in treating these disc conditions. So again, we do the normal work, therapy, rehab. We have a great massage therapist who works part-time with the Steelers, and he works in our office part-time as well. So we have the best people here at our office. And we have many other treatment options as well. We mentioned for the neck as well, for the disc as well. But again, since 94, we've been known as the area's disc specialty center because of our experience, and we have the best, most proven treatment options for these difficult herniated disc, bulging disc, degenerative disc disease, sciatica, spinal stenosis, and even failed back surgery cases. So this is truly a revolutionary treatment that has a proven track record, as we mentioned, a very safe treatment, cost-effective treatment used in over 300 facilities worldwide, hospitals, medical clinics. There's a few orthopedic surgeons that use VAX-D in their office, chiropractic physicians, even physical therapists using this wonderful VAX-D treatment. There's approximately 3,000 patients a day currently being treated with VAX-D therapy. This, again, is, of course, VAX-D, standing for vertebral axial decompression. Again, I very much hesitate, as I talk about all the time, to use the term decompression because it's so loosely used. So many people use decompression for devices that are truly not decompression. But VAX-D, again, is the originator of decompression. They started decompression, and they perfected their machines and made it better and better and better. and continues to be backed by real science with real results. So as I always ask you out there listening to this radio show, if you know someone, you yourself, you know someone who has back or neck pain, unresponsive to your current treatment, you want to avoid further pain medication, pain shots, you're going to a pain clinic getting epidurals, pain shots, you've gone through physical therapy, it has not worked for you. We talk about the issues with physical therapy. Many patients come to us. They hope that the physical therapy, after they've been diagnosed with a back problem and or they know they have a disc problem, hoping that that physical therapy is going to solve the problem. In most cases, it doesn't, especially in more severe cases. In some cases, it can actually make it worse. And we do therapy here at the office, but as I always say on this show, if you listen to the show each week, there's a time and a place for physical therapy. And in many cases, the therapy, even an adjustment in some cases. Now, many people go to chiropractors like myself for disc problems, and they take care of the disc problem very readily with the adjustment and the exercises given. In some cases, though, we get referrals because now the adjustment has maybe a limitation. They have a more severe herniated or extruded disc. It's not responding. In some cases, even the adjustment itself could be irritating, just like the physical therapy. So we take a step back. When we see that, when a patient comes into our office, we diagnose the problem first. We put down a treatment plan, and once we start the treatment plan is geared toward reducing the inflammation within the disc first, stabilizing the condition first, getting things under control, because if you never get it under control and you try to go in there and try to move the area around too aggressively, in some cases, not all cases, in some cases, you could just irritate. So we take a step back, and then we slowly incorporate the therapy in a more conservative fashion first, and then get more aggressive as the disc heals, and then get back into the adjustments, whether sending the patient back to their chiropractor that referred them here, or doing the chiropractic care in the office, which is extremely important to help the condition from reoccurring, keeping that spine in alignment. But again, if you do it in the beginning cases, the acute cases, in some cases, it can actually make the problem worse. So we see that very, very commonly. So also, if you're contemplating surgery, you want a second opinion. You've already had a failed surgery, a second, third, or fourth, or even further surgery. We've had people with 5, 6, 7 failed back surgeries. It's unbelievable that they keep doing it, and they keep sending them for surgery. As you know, each subsequent procedure has a lower success rate than the first. So each time you have a back surgery, your success rate's even lower, and then your rate of complication is even higher. Remember, it's a permanent procedure with possible permanent complications, surgery. If your symptoms are radiating into your hip, your buttocks, your groin, down your legs, numbness and tingling, weakness, you may have a disc-related condition. You may have stenosis related to a disc, sciatica. These are very common conditions we see each and every day, and VAXD very effectively treats and is the only FDA-approved, safe, clinically proven, non-surgical disc treatment for those type of problems. So again, we are doctors dedicated to bringing you long-term relief. There's over 300 facilities, medical doctors, orthopedic surgeons, chiropractors, physical therapists, doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today if you'd like to come to our office. Our toll-free number is 1-888-222-8293. Again, toll-free. That's not 1-800. It's 1-888-222-8293 or 724-935-3300, 724-935-3300. Also, our website, if you'd like to check out our website, we have a lot of great information on the website about the VAXD. Many of the questions you may have can be answered on the website as well. Of course, you can always call us today. We have open phone lines, 412-825-6262. If you have any questions for me today, of course, you can call our office. I just gave you the toll-free number as well as the 724-935-3300. If you have any questions, you can also ask the question on the website. You can request an appointment on the website as well. The website is www.americanbackcenters.com. That's plural with an S, centers, americanbackcenters.com. Request an appointment. We usually get back to you within 24 hours if that time is open and available. You can visit our blog as well as sign up for our daily Health Update newsletter. And we reference it from time to time on the radio show and the nutrition fitness segment. It's a great resource. You get health information, health tips, updated each and every day, an inspirational quote for the day to start off your day each and every day as well. If you don't have time, you can delete it, and you get new health information the next day. You can cancel at any time. Yeah, it's totally free. And the great perk is once a month you automatically get signed up for the monthly In Good Hands newsletter. And it's a wonderfully done piece. It's about 7 to 10 pages. It comes out once a month. Some of the greatest minds in the country. Just got a book when I was on my cruise vacation, and from Dr. Mike Rosen. And the foreword was done by Dr. Oz, Dr. Oz from TV. It's called Age Proof, Living Longer Without Running Out of Money or Breaking a Hip. So it talks about health as well as finances into as you're getting older and age-proofing yourself. So I highly recommend that book if you'd like to try it. But what I was getting at is some of the authors of that book contribute to this daily, I should say not daily, the monthly In Good Hands newsletter comes out once a month. So you have some of the greatest health minds in the country contributing to this, and you get this free of charge when you sign up for the daily Health Update newsletter. Again, go to our website, www.americanbackcenters.com, and you can, again, that's plural.com, and then look for the daily Health Update newsletter, and you can sign up for that, and you automatically get signed up for the monthly newsletter as well. Again, if you didn't miss that book, and I highly recommend it, it's called Age Proof, Living Longer Without Running Out of Money or Breaking a Hip. It's from Dr. Mike Rosen, who's a medical doctor, and Ted Spiker, and some the forward and introduction is from Dr. Oz as well. We all know Dr. Oz. Dr. Rosen's been on the Dr. Oz show many times as well. So it's a brand new book. Just came out this year. Update information, so you can check that out. Check out our website, the newsletters I talked about as well. Also, our fax number. The reason why I give out the fax number is if you like to fax over any reports. A lot of people are coming a great distance to our office. They want to fax over their MRI, CT, X-ray reports. We highly recommend that. You can just fax it over even if you're just a short drive to our office. You're coming in for a consultation. You want to have it ready for us. We can take a look at it before you come in for your consultation. So we're ready for you. You can fax it over as well. 724-935-3321. 724-935-3321 is the fax number. Remember, it's very easy. Just remember where you had it done at. Call that facility. Give them our fax number, and in many cases they can do all the work for you as far as getting that faxed over to our office. If you're coming from a great distance, as I mentioned, we do have a list of hotels on our website. You can see some overnight lodging. We have people coming from many hours away to seek our treatments, especially for the VAC-C therapy. Because we're the only one in this area that has it at this point. We have over 20 years of experience treating these type of cases. So our success rate is a little bit higher than most facilities because of the many years of experience and the other things that we do that go into our program. When I say that, the other modalities, we've perfected our program. Our disc treatment program is unique and very effective because we've been doing it for many years and we've added things to our program to make it even better. So again, www.americanbackcenters.com is our website. Check that out, as well as our phone number, 724-935-3300, and the fax number if you'd like to fax over any reports, 724-935-3321. As I do each and every week, some of the other unique services we offer here, in addition to the VAC-C, which is a medical procedure, the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. We also offer cervical disc treatment. So if you're looking for cervical decompression treatment, a true decompression treatment, not a traction treatment, disc bulging, herniation in the neck region, degenerative disc disease, posterior facet syndrome, even failed neck surgery are cases we typically see here. If you're contemplating neck surgery, give us a call first. Get a second opinion first. We have the experience. We know what to do as far as implementing the appropriate treatment program. We're not novices to this. We've been doing this for many, many years. So we know what we're doing with these procedures, and we do it right. And we do it in a very conservative fashion with your safety being first. So we have no problems with that. A lot of patients are concerned that they're coming in. They come in our front door. They see the words chiropractor on the front window, and they're like, are you going to be adjusting me? I have a disc problem. I've been to a chiropractor before. And my answer is, number one, chiropractic is a wonderful thing. for treating disc problems. But in some cases, yes, it has limitations on what it can do, and that's where the specific disc treatments come in for the neck and back when you have a more severe case. You've gone to your local chiropractor, you've gone to a therapist, it's not helping you. Pain medication, of course, just putting a Band-Aid on the problem. That's where we come in. And again, we do chiropractic, but we're not a typical chiropractic office. We're a specialty clinic. We're a disc specialty center. We have specialty treatments specific for these more serious issues, and we've been doing it for over 20 years. As I mentioned, therapy and rehab, state-of-the-art facilities, individualized programs, ergonomic and postural instruction, treating these type of problems, wrist, hand, finger, foot, ankle, knee problems, extremities, examples including sprain, strain of those areas, tendonitis, rotator cuff, carpal tunnel, and frozen shoulder. Deep tissue massage. We have great massage therapists, myofascial, trigger point therapy, acupressure, reflexology done right here at the American Back Centers. Comprehensive nutrition through standard process. We can even send you the symptom survey if you can't make it to the office. You can either send it back or bring it back, and we'll score it for you based on standard processes scoring system to give you again, an individualized, comprehensive nutritional profile based on your symptoms, your individual symptoms, not someone else's, your individual symptoms grouped through different body regions. Custom-made orthotics, computerized digital scanning system assessing for foot dysfunction. So we have a very high-tech 3D system that you simply just stand on. It scans your feet. It gives you a nice computerized color printout of any possible problems, and not everyone has problems, contrary to what people think. It's not a money-making machine here. We're looking to see if you have problems. There's plenty of people that go on there that have no problems at all. We're just trying to see if the feet are contributing to problems in your back, your knees, your hips. A lot of people are suffering from hip problems, knee problems. You treat the knee, you treat the hip, but if you're not looking at the areas above and below, namely the feet or the back, when we talk about the knees to the hips, you're not addressing the total picture. And people wonder why they're not getting well because they have problems in the arches of their feet, they have plantar fasciitis, they have bunions, all these things that are contributing to compensation in the knee and the hip, and they're wondering why their knees and hips are not getting better. So a very high-tech way of assessing this, and a truly custom-made orthotic. So many people claim custom-made. I've talked to people that have gone to places and they say it's custom-made, but yet they go and pull one off the shelf the same day when the patient's in the office. How is that custom-made? So this is truly custom-made. It's sent electronically to the company. It takes about 5 to 7 business days to send it back, and you truly get a custom-made. It's custom to your shoe and your individual scan. Great, great product. Patients love these, and they truly work. So if you'd like to try the custom-made orthotics, call our office and schedule a consultation for that as well. Acupressure treatment, we have great success with many different issues, especially with sinus drainage, sinus-related issues, allergies as well. Respond very well to acupressure treatment. In-house X-ray, nerve conduction, ultrasound testing done right here at the American Back Centers. A convenient MRI facility, CT facility right across the street. If you need that, we can give you a prescription and send you right across the street, North Pittsburgh Imaging, to get your MRI CT scan. Finally, I'm a certified personal trainer, so I can help you get back in the gym and do things the right way. Many people have good intentions, but they end up just hurting themselves when they go back in the gym. Of course, we don't want to see that because then you end up here at our office again in pain. We want to solve your problem and get you well permanently, so we want to make sure you do it right. So we can help you with that as well. When we talk about VAXC, we talk about nationally VAXC successful in about 75% of all cases that come through the door of a VAXC center. Our success rate is over 92% here at the American Back Centers. Again, we have over 20 years of experience, one of the most experienced facilities in the country. We've perfected our protocols. Our protocol is physician-directed. Our protocol engages other modalities as needed on a case-by-case basis. Of course, one of the most experienced facilities in the country instituting this type of care. And we screen out and decline candidates whose medical records and evaluation indicate we're unlikely to help them. So if we say we can help you, you have a really good chance of doing well with this procedure, and you'd be surprised how many people we accept. And a lot of people are thinking, well, that's why their success rate is so high, because they're very picky in who they choose. Yes, we are picky, but this procedure can help so many people. There's a lot of people that have neurological deficit, foot drop, They're told by their surgeons that surgery is their only option. Don't mess around with any type of therapy. And that's simply not true. We've helped people with failed back surgery, multiple failed back surgeries, foot drops, severe neurological deficits, severe pain, extruded discs, the worst type of disc cases. And again, it all depends on what we see with the examination history, and most importantly, your CT, MRI scans as well. So you bring those in when you come in for your consultation, and we can discuss that. So again, the VAC-C table and its computerized treatment work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure. That's the key. So it reduces the pressure within the disc moment by moment. The computer adjusts the tension in very small amounts so that the muscles in the lower back do not spasm or contract during the treatment, which allows true decompression to take place. And that's what's unique to VAC-C. These other so-called disc treatments, these decompression treatments, these traction treatments, cannot claim that. There's no research supporting that. They can claim that they help, say, there's a group of 100 patients in a controlled setting. They've helped those patients. Have they lowered their pain levels? Have they solved their problem? Just like with back surgery, these laser spine surgeons claim 98% success rate. How could you help 98% of people? There's no way that you could help 98% of people, but they claim that. But the issue is the patient may have less pain for a day, a week, a month, then the pain comes back, but they still claim success with that. You'll see that with other research studies as well. Again, if you want true research studies showing the effectiveness of a treatment, it has to show that the treatment actually does what it says it does, decompressing the spine. With VAC-C, to date, the only medical device that has been proven to do this. And again, this was published in the Journal of Neurosurgery back in 1994 and continues to be replicated in research studies. So if you'd like to schedule a free consultation, no cost or obligation, again, call us toll-free 1-888-222-8293 or 724-935-3300. Or you can go on the website and request an appointment as well. Again, a free consultation. We sit down with you, answering all your questions. We don't rush you out of the office. We take time with you. We encourage you to bring in your spouse, family members, friends, neighbors when you come in. Number one, it's helpful to have somebody drive you out here if you're in pain. It's helpful to have somebody with you when you're going through this situation. And we're very careful to answer all your questions. We do a detailed history, physical exam, and then we look at your MRI, CT, X-ray. So bring all those in. Bring those things in. When you come in, you can also fax them over if you'd like to ahead of time. Again, the fax number is 724-935-3321. We also offer that free DVD. This is when Channel 11 WPXI did a medical breakthroughs report on the American Back Centers. We were on the Channel 11 News, and they showed how effective our treatment was even years back, helping people with these difficult disc-related conditions. And Dr. Miskovich was interviewed by Dr. Rosen from Channel 11 WPXI, and very nice piece on the VAC-C. You can see it in operations. There's some great patient testimonials on there as well. Just call us today, and we'll simply just send it out to you free of charge as long as you still have a DVD player. I know a lot of people are getting rid of their DVDs. As long as you can still play DVDs on your computer, or if you have a DVD player, I'll throw it in there and take a look at it. In addition, we have the research papers we send out to you all the time. The research was done right here at the American Back Centers and published in the Canadian Journal of Clinical Medicine. We're very proud of that. First paper we send out, the Knife in the Back article, we've been sending this out for years, showing the failures of back surgery and why surgery is not the best approach for chronic back pain, specifically fusion surgery, the rods and the screw surgery. Very, very invasive, but it's a money-making procedure for these hospitals and medical clinics. We talk about how when you fuse a segment, it takes care of the compression, which is the cause of the problem, just like VAC-C does, but now the areas above and below have to compensate for that fused segment that's not moving, that's supposed to move. So it's kind of like taking a link out of a chain. So then if you're already having, and it's funny because I talk to patients when they're saying they want to get surgery, and they have a bulging disc at 3-4, 4-5, L4, L5, and then a herniated disc at 5-1, or vice versa, and they want to fuse the herniation. And I tell them, I said, they're going to fuse that herniation, but you already have bulges occurring, if not herniations, and don't you think that that's going to get worse now once that segment's fused? Those segments are going to have to compensate for that fusion, and it's only a matter of time till they get worse. Sometimes they understand that, sometimes they don't. So you go in and get that fusion, now those areas that are already suffering are going to get worse, and then you're going to go back for another surgery. I've seen it time and time again. Finally, we also have the blue workers' comp book and the yellow auto accident booklets. Great resources. I hand them out every day. Just hand a couple out yesterday to workers' comp patients. Many people are taken advantage of by the workers' comp system. They don't know their rights. Many people are blatantly lied to by the insurance companies and or their employers. They're told to go back to work much sooner than they should be, even if they're in pain. They're told they can't do this and that, when simply they can, and they have rights and they don't know it. So if you know someone that's been hurt at work, hurt in an auto accident, get the yellow auto accident or the blue workers' comp book. Just call our office, ask for the blue or the yellow book. They are both free of charge, and they are done by attorneys in the Philadelphia region, so they won't be calling you and soliciting you. It's a wonderful, wonderful law practice out there in Philly that normally I don't say too many good things about Philadelphia, and I hope I'm not offending anyone. My wife's from Philadelphia, but you know how it is with Pittsburgh and Philadelphia, the rivalry. But, you know, they're great, and they're not getting business, but they still send out these to our office as a free resource to you to help you avoid these possible pitfalls and problems that you may occur in workers' comp or a auto accident. Finally, we talk about surgery. The real question should always be, as we talk about each and every week, why would you even think about surgery with all its complications and lack of success? Not including the normal risks that can occur with any surgery, infection. I had just a couple of patients that had their knee replaced. I even have a neighbor that had bursitis in her knee, and she ended up having a massive infection. So any surgical procedure, but especially spinal surgery, infection, bleeding, blood clots. Remember we talked about Dwight White, Pittsburgh Steeler, great steel curtain, fifth back surgery. He had a blood clot and died. That can happen. With the more surgeries you have, the higher the risk of that occurring. But that's not even including spinal surgery in general, the lack of success that we talk about with these procedures. Again, VAXD is an option, a very safe, non-invasive option with a much, much higher success rate than surgery. Pain injections, or even physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us sooner or first. Remember, VAXD addresses the structural issues, not just the symptoms. Truly, decompressing the disc, restoring the fluid content to that compressed, desiccated disc, taking the compression off the spine of the disc, relieving your pain associated with low back pain, disc problems, herniated, degenerated, extruded, bulged, sciatica, stenosis, numbness and tingling, and even failed surgery cases. So again, a quote from a famous researcher, the overuse of surgery has been perhaps the single most damaging medical intervention for back pain sufferers. Surgery seems helpful at most 2% of patients with back problems, and its, quote, inappropriate use can have a great impact on increasing the chance of chronic back pain disability. So the rate of disability is even increased, and I see this with my father-in-law. Before he knew me, he ended up having his back fused. Now he's been disabled since the age 50, 51, 52, I believe, to be exact, and he can't even cut his own grass. Never going to work another day in his life because now he's disabled. And there's not much you can do once you have your back totally fused. Now, if you just have one segment fused, that's a different story, but if you have the entire back fused, you're pretty much done at that point. All right, I'm going to give you a quick testimonial. This is from a medical doctor, back pain specialist. I think I've given this to you before, board certified in neurology and pain medicine. Goes on to state, adding VAXD to my practice has been a most impressive and rewarding experience. I have treated hundreds of patients over the years from age 17 to 84 with this non-invasive, non-surgical, non-drug treatment. I am thrilled to offer a treatment that has led to the reduction of the use of many medications and an increase in quality of life. Finally, there's a chiropractic doctor of chiropractic, goes on to state, VAXD has literally been a godsend for many of my low back pain patients over the last 15 years. Numerous VAXD candidates have tried everything short of surgery prior to seeing us. They often arrive in desperation, hoping for a conservative solution, and VAXD offers them that a potentially highly successful solution. We currently have saved over 1,000 patients from disabling pain and potential disc surgery. Our patients are extremely grateful for this therapy. And finally, a patient, his name is Ted, who received VAXD therapy, goes on to state, my legs were numb, and I was seriously worried. I had a herniated disc and 2 bulging discs in my lower back. When I began the vaccine treatments, I started noticing results right away. I was feeling confident that something positive was being done instead of just taking a drug to cover it up. Thanks to this therapy, I'm able to lift piles of folders at work, bend over with ease, and even ride my bike to and from work without pain or numbness. I now actively enjoy my life. I'm able to water ski and get up to 72 miles per hour, which is my favorite treat. All right, so that's a couple testimonials from doctors as well as patients that have vaccine in their office on the effectiveness of how it works. So again, we've been doing it for over 20 years here. We've seen those success stories. We have many of them, and it's a wonderful, wonderful treatment. So if you're out there listening, you yourself, you know someone who's been suffering from these type of problems, call us today to schedule a consultation, toll-free 1-888-222-8293 or 724-935-3300, or visit our website, www.americanbackcenters.com. All right, I'm really excited to get to this before we get into the nutritional segment today. We touched on this a few weeks ago when we were live. We have a new product, and a little bit controversial, but it is legal in all 50 states. It's the FDA-approved active ingredients. It's the product from Healthy Hemp Solutions. I'm sure you know what we're talking about, hemp oil. And it has different levels depending on the level of the product. It's level 1 through 5. Level 5 has a very high level of CBD. That's the component of the hemp plant that has the health benefits, so you're not going to get high from this product. Very, very cutting edge, per se. A lot of people are talking about the hemp oil and how effective it is. Patients are trying it, and the topical cream is helping them with severe pain issues, even more so than your standard BioFreeze. And not to say the BioFreeze isn't a great product, especially the BioFreeze Professional that we're now offering at our office. BioFreeze has decided to open up their markets to Target and Walmart and such, so they are selling the regular BioFreeze in Target and Walmart now, and the doctors get the BioFreeze Professional. The Professional's a lot stronger, and it lasts a lot longer, but you can still get the normal BioFreeze now at Target and Walmart, but if you want the more potent product, you come to the doctor's offices and get the BioFreeze Professional. But the hemp oil seems to be even more effective as far as the more difficult cases, especially as you go up in levels. Now, level 5 is going to be a lot more expensive than level 1, but you're getting more concentrated product. So patients are seeing a great solution to every pain level, even the more severe pain levels, fast, long-lasting relief for these severe pain issues. And, again, cannabis-infused, they're analgesic ointments and creams, legal in all 50 states, and they are FDA-approved. And you can get it right here at the American Back Centers, depending on what level of pain you have, level 1 through 5. I want to talk a little bit. We also have a hemp oil that comes in a liquid form that you put underneath your tongue, sublingual, and it's called Charlotte's Web. And there's a great research publication talking about cannabinoids, and these are a group of closely related compounds that act on the cannabinoid receptors in the body unique to hemp or cannabis. The body creates these compounds while hemp produces them naturally. We're seeing a lot of great results. If you've gone on YouTube or the Internet with Parkinson's patients, how they've given them the hemp oil in this concentrated form, 1 drop underneath the tongue, sublingual, the tremors have gone away. Now, I'm not saying it's going to help everyone, but there's some truly amazing results with people with autism. They're seeing some results with. We talked about Parkinson with the tremors and such. And I always tell patients it's worth trying because it's very safe and it seems to be effective. It's not going to help everybody, but they're seeing results with the medical properties of these cannabinoids where they're reducing nausea and vomiting, suppressing possibly seizure activity, combating psychosis disorders, schizophrenia they've seen results with, as well as autism. Combats anxiety and depression, possibly a natural antidepressant that works very well. Combats possibly, again, they're not making claims, they're just stating that it's possible it can combat tumor and cancer cells, combats free radical damage possibly, a natural antioxidant, very powerful, as well as inflammatory disorders, so it's anti-inflammatory as well. So if you'd like a concentrated form for those type of problems, there's a sublingual drop form that comes in a little dropper that goes sublingual under your tongue. and they're seeing possible great results with autism. Again, we're not making claims here. Autism, schizophrenia, other psychiatric disorders, where there's depression, as well as seizure activity, possibly as well. And it's worth trying. And again, I tell patients over and over, it's worth trying, because if it works, it can possibly get you off those drugs. And again, we're not telling you to get off the drugs, because you may end up having withdrawal symptoms and problems. But that's something you want to talk to with your medical doctor as well as a possible alternative to the medication you're taking. And especially the people you're seeing with tremors, Parkinson's, and the like, the possibility of reducing the medication would be wonderful. So we offer that at our office called Charlotte's Web, and it's from the world's most trusted hemp extract source, and it's a wonderful product, as well as the Healthy Hemp Solutions ointment creams, levels 1 through 5 that are cannabis infused. So if you'd like to try those, call the office. We can send them to you. We can pick them up right here at the American Back Centers as well. Finally, we also have the Intramax. We talk about the all-in-one liquid multivitamin. It's a great product. If you're looking for the best multivitamin on the market, it's a liquid product. It's highly absorbed. Peer-reviewed double-blind studies showing the effectiveness. I take it myself. For the adults, the Intra-Kid for the kids. If you'd like to try it, call our office. We offer a discount for trying your first bottle or free shipping. Finally, we have the alternative to glucosamine. Glucosamine hyaluronic acid. If you're not doing well with glucosamine hyaluronic acid supplements, you may want to try esterified fatty acid complex. Some great research showing that people that have failed with glucosamine and hyaluronic acid may do well with esterified fatty acid complex. So it's a latest and newest way to defeat pain and restore joint health. If you're looking for a joint replacement, you want to avoid a joint replacement, hip or knee, you want to try a product to help rebuild some of that cartilage. If glucosamine hyaluronic acid has not worked for you, you may want to try the esterified fatty acid complex. We have it here in a cream as well as in a capsule form. Call our office and you can give it a try. All right, so we're going to get into the nutritional segment. We have about 20 minutes to go here. And avoiding the risk of testosterone therapy with simple, inexpensive diet and lifestyle changes. This is from McCullough's Peak Fitness section of his website, drmccullough.com. And actually, it's www.mercola.com. Goes on to say testosterone plays many important roles in men's health. Besides affecting your sex drive, it may also help maintain muscle mass, bone density, red blood cells, and a general sense of vigor and well-being. Beginning around the age of 30, a man's testosterone levels begin to decline and continue to do so as time goes on, unless you proactively address the lifestyle situation. Common symptoms of declining testosterone levels include, number 1, decreased sex drive, erectile dysfunction, problems with urinating. Number 3, depression. Number 4, difficulties with concentration, memory. Number 5, weight gain and or breast enlargement, female breast enlargement in males. Lifestyle changes such as limiting sugar fructose in your diet, which we've talked about on this show many times and Dr. McCullough has talked about, while boosting your intake of healthy fats, engaging in high-intensity exercise. We talked about that a lot. Strength training and optimizing your vitamin D levels and reducing stress are all helpful strategies to get started, just shown to boost your testosterone levels naturally. What about testosterone treatment is the question. Next paragraph, beware of testosterone drug ad promises. Hormone replacement therapy is a tricky business. We've talked about this when we talk about estrogen therapy, due to the complexities of how different hormones work together, mode of administration, timing, dose, and many other variables. It's virtually impossible to make responsible recommendations that apply to most people. When it comes to hormones, you really need to work with a competent doctor who's well-versed in the subject and keeps up on the latest advancements in testing as well as treatment. Unfortunately, direct-to-consumer drug advertising, which is permissible in the U.S., drives many people to use testosterone even though they're not good candidates for it. This is, again, the hormone prescription therapy. Lacking energy in sex drive does not automatically mean you have a testosterone deficiency warranting taking this hormone. Previous research has found significant individual variations in the amount of testosterone required for any particular man to maintain lean body mass, strength, and sexual function. Other hormones, even the female sex hormone estrogen, also play a critical role in men's health. So the singular focus on testosterone replacement may be inappropriate and an unnecessary risk. Some of the benefits and risk of testosterone therapy, we're talking about the prescription therapy. Most recently, a set of 7 interconnected federally funded clinical trials involving roughly 800 men over the age of 65 revealed both benefits and risk of testosterone therapy. In older men with low testosterone levels, short-term, 1-year treatment was found to boost bone density and strength, especially in the spine, and reduce anemia. As far as cognitive is concerned, no significant improvements were noted in the men's memory or problem-solving skills in a short-term 1-year treatment. On the downside, 1 year of testosterone treatment also increased the risk of cardiovascular events in men aged 65 and older who had a serum testosterone level below 270 nanograms per deciliter in symptoms of hypogonadism. Sorry, can't get that out today. Compared to the placebo group, those receiving testosterone had a greater increase in coronary artery plaque, a 20% increase compared to a 1% increase in the placebo group, which is a rather significant difference. However, a separate study by Southern California Medical Group in Pasadena found that androgen-deficient men age 40 and older with documented low morning testosterone levels of less than 300 nanograms DL, testosterone therapy was not associated with increased cardiovascular risk. In fact, a follow-up over the course of 3 years suggests that the risk of cardiovascular outcomes was 33% lower in those receiving testosterone than the placebo group. However, the study was not a placebo-controlled trial. It merely examined the medical records of 8,000 men who were prescribed testosterone therapy to identify instances of heart attacks, angina, stroke, or sudden cardiac death over a period of 3 years. So next paragraph, still no hard and fast rules on testosterone therapy. As noted by Susan Ellenberg, professor of biostats at a medical school, University of Pennsylvania, who co-authored the study, she goes on to say there are definitely benefits and potential risks. It's not an overwhelming conclusion that every man over 65 should be on this or stay away from this. Indeed, 3 testosterone trials published last year produced a similar mixed bag of results. While men over 64 with low testosterone levels experienced modest improvements in libido while put on testosterone gel, the treatment had no beneficial impact on general vitality or walking ability. Meanwhile, a study published 2 years prior found that men aged 65 and older who took testosterone doubled their risk of heart attack within the first 3 months of use, even if they did not have heart disease prior to starting the therapy, doubled the risk during the first 3 months of use. The result was similar in younger men diagnosed with heart disease. So as we skip forward here, some of the natural, and he calls it 9 body hacks to optimize your testosterone levels naturally. While a man's testosterone level does decline with age, starting around age 30, there are many factors beside aging that play a role. Think of generations past when men were active and healthy into old age. Clearly, it's possible to grow old without losing your, quote, oomph. So unless you're working with a hormone specialist, the safest bet is to simply address lifestyle factors known to influence your testosterone level. Some of the things that the video, if you go on his website, illustrates, to give you a summary, is, number 1, weight loss. Visceral fat, internal belly fat, is known to suppress testosterone production, so reduce your visceral fat. High-intensity exercise, strength training, limit or eliminating sugar from your diet as insulin spikes sabotage your production of testosterone. Optimizing your vitamin D levels, as we mentioned, as well as zinc. Reducing stress, chronic and unaddressed, can lead to inhibition of testosterone production. As we mentioned, increasing zinc as well as magnesium. Magnesium has been shown to improve sex hormone levels, including increasing testosterone and human growth hormone. Eating healthy fats. You're not shunned away from cholesterol-rich foods, as your body cannot produce testosterone without cholesterol. Research shows a diet with less than 40% of energy as fat, mainly from animal sources, leads to a decrease in testosterone levels. Boosting your intake of branched-chain amino acids. This is best accomplished by whole foods and whey protein concentrate, not your isolate, whey protein concentrate. We talk about sex, drug, and food, other considerations that may affect your testosterone levels. Some other things as well. We talk about statins. Statins can attribute to testosterone if you're on a statin drug deficiency. So make sure you're being careful with that. Also, with low libido and erectile dysfunction or symptoms of low testosterone, know that having sex will, in itself, boost your testosterone levels. If you're not having sex, that can be a problem, reducing your testosterone naturally as well. Some other things he mentioned. Pomegranate. 1 glass of pomegranate juice per day increases testosterone levels between 16% and 30% in one study. Authentic extra virgin olive oil also helps reduce testosterone levels as well. Zinc-rich foods, wild-caught Alaskan salmon, oysters, sardines, anchovies, cashews, and raw pumpkin seeds. Coconut and coconut oil improves your ability to make cholesterol, which is necessary for testosterone production. Cruciferous vegetables, such as broccoli, cauliflower, excrete excess estrogen, which we know can contribute to cancer, also increasing available testosterone. And finally, garlic, while it does not contain any necessary nutrients to produce testosterone, it does contain allicin, a compound that lowers cortisol. When your cortisol levels are lowered, your body can more effectively and efficiently use testosterone that is produced. Another effective strategy he mentions is enhancing testosterone is that intermittent fasting, which you're hearing more and more about. Another way to maintain healthy testosterone levels, intermittent fasting throughout the day. Also, some other healthy supplements he mentions, saw palmetto. We all know that's good for your prostate. Also good for symptoms of low testosterone, actually increasing levels of testosterone by inhibiting upconversion to dihydrotestosterone, or DHT. Astaxanthin, as we talked about on the show many times, in combination with saw palmetto, helping to increase testosterone production naturally as well. We also have a nice product here, if you're interested. It produces testosterone naturally. It's called Progene. It has dual-action formula containing clinically proven testosterone precursors as foundational ingredients to produce more testosterone. They're coming from herbal and botanical extracts only, known to help support production. So, again, it's all natural. Again, if you're looking for more energy, reduced belly fat, faster recovery, they actually have a test kit that goes with it as well that you can do at home. The take-home saliva test kit, and everything's included. It's very inexpensive. They even pay for the postage to and from. The lab testing as well is all included when you buy the test kit. We have them here. You can order them from us. And then if you do see that you have low testosterone levels, and again, that's really the only reason why you should be taking a product. If you have low levels, number one, you got to make sure you have low levels first. If you have low levels, then you can try a product such as the Progene that we offer here at our office. It's made right here in the USA, of course, and it's a great natural way to produce testosterone production. So there's no drugs; it's all natural. Also, use the recommendations we gave you here today through Dr. McCullough's article, dietary and lifestyle changes as well. So the story at a glance, a summary: 7 clinical trials reveal both benefits and risk of testosterone therapy in older men. While improving bone density and reducing anemia, it may also lower your risk of cardiovascular disease. But there's some downsides. So there's conflicting information showing if it's effective or it may actually cause more harm and side effects. But the safer way is looking at your diet and lifestyle, limiting your sugar, boosting healthy fats, engaging in high-intensity exercise, strength training, optimizing vitamin D levels, reducing stress. We talked about zinc, magnesium, saw palmetto, astaxanthin as well. All helpful strategies known to help boost your testosterone levels naturally. Having sex, avoiding drugs that lower testosterone as a side effect, as we talked about, statin drugs, intermittent fasting, eating testosterone-boosting foods, and taking certain herbal supplements, like what we have here, the Progene, can also safely raise your testosterone levels. So again, if you don't know that you have low levels, you want something you can do very safely at home, this is sent out to a lab, simple saliva test that you do in 1 day's time, 4 tests. You send it out to the lab. Just call our office. We can send you the test kit. All the postage is paid for. When you pay for the test kit, the testing is paid for. They send it back to you. If you have low levels, you can follow the dietary recommendations, which I would recommend to you anyways. But if you need an extra, if you're extremely low, then we have the natural product called Progene as well here at the office. So call our office if you'd like to try the test kit, or if you already know you have a low T-score, they call it. you can try the product as well. And definitely first try the dietary and lifestyle changes and see if that helps you as well. Bring that level up naturally. Because many things we're doing, as we talk about on the show, we're doing unknowingly through diet and lifestyle, actually are causing problems, suppressing the natural production of growth hormone as well as testosterone. We talked about some other things, too, about working out, making sure you're not having any sugar right after your workout, because Dr. McCullough talked about how that suppresses your growth hormone production, having sugar right after your workout, talking about some other things, keeping that workout high intensity and short in duration, so you're not in the gym walking on that treadmill for 2 hours. That actually suppresses your growth hormone. And giving yourself adequate rest between your workouts as well, allowing for recovery, which is very important. As we get older, we all see that we recover less quickly from our workouts and our activities, so you need to recover properly as well, because you could be damaging the body and causing problems as well. Remember back a couple years ago, we talked about how these high-endurance triathletes were having heart attacks and heart problems because they were overstressing the body. They're doing good things by exercising, but actually overstressing their body, not allowing the body to recover. So more is not always better, as we always say. All right, we are short on time, so I'm going to leave you with some final closing thoughts. As always, why would you even consider surgery when vaccine is available? Please be smart. Remember, surgery is a permanent procedure with possible permanent complications, including infection, bleeding, blood clots, scar tissue, advanced degeneration, the simple fact that they're not very successful. A smart, educated person who knows this and regularly listens to this radio station and show knows this and will usually make the right choice for their health. I want to thank you for listening today. We'll be on next Wednesday and every Wednesday with another episode of BackTalk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to Back Talk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for Back Talk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.